Hi, I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. And today I'd like to talk to you about a way that I teach psychiatry residents about the balance between support and insight in psychotherapy. But first, um, what's a psychiatry resident? Really briefly, to become a psychiatrist in the United States, it requires going to college or university, generally for 4 years for an undergraduate degree, then to go to medical school for an additional 4 years to get a medical degree to become a physician, and then nowadays almost all doctors specialize in something. Even general family medicine doctors have a family medicine residency, and that's true of all the specialties of medicine you can think of. There are surgical residencies and residencies to be a pediatrician or an eye doctor or a dermatologist, and to be a psychiatrist, there is a psychiatry residency, and it's 4 years long. The psychiatry residency covers a lot of different kinds of things in psychiatry, including working in an inpatient setting with more severely disturbed patients, and also doing outpatient work, working in an office like I do now, that emphasizes both medications and medication evaluation and management, and also psychotherapy. And for many years, basically my whole career, I have been an instructor in psychiatry residency programs, mainly talking about outpatient evaluation and psychotherapy. So that sets the context. For many years now, I have been leading seminars and supervising psychotherapy for residents. And I've been talking about how to conduct psychotherapy. One issue that comes up in conducting psychotherapy, especially if one is just learning it, is a tendency to think that some patients are capable of understanding themselves, of gaining insight, that they can benefit by the kinds of traditional insight-oriented or uncovering therapies that I've called in a previous video psychodynamic, and that other patients aren't really capable of that, or that it isn't really in their best interest, and so that one should be simply supportive. As though one could decide at the beginning when evaluating a new person, a new client or patient, this one is an insight patient and this one is a support patient. And actually, my teaching is that that's not true, that actually everybody is capable of degrees of insight and that everybody needs degrees of support. And so I developed an analogy that I've used for years, actually, to illustrate this idea. And it involves sailing. Many years ago, I was trying to learn how to windsurf. I know, look at me now, that's kind of ridiculous, isn't it? But I was. I never got very far with it. But what I was really struck by, in addition to how hard it is to learn to windsurf, is that you could stand there on the board. If you weren't moving, it was pretty stable. But as soon as the wind caught the sail, it felt very unstable, and there was a real challenge in keeping it upright and not falling into the water. I didn't stick with this very long. I quickly realized that this was sort of true with sailing in general, especially on small boats, also something I haven't done very much, that the boat is pretty stable if it's not moving. just floating in the water. But if the wind catches the sail and propels it, the boat tips over and it feels a little unstable, and so on. And I had the sense that this was a good analogy for psychotherapy, that if the patient is comfortable being supported, not being challenged, the boat is stable. It's not going anywhere, but it isn't likely to tip over either. But as soon as it becomes challenging in therapy, something like pulling on the sail a little bit and letting the wind catch it, then the boat moves and it feels a little unstable in the process. And the real point I was trying to make with this analogy is that it's not something you decide at the beginning. You don't say, well, I'm just going to hold the sail this tight the whole time I'm sailing. That wouldn't work. You have to adjust it in a moment-by-moment way. And in the same way, a new psychotherapist learning how to practice their craft needs to learn how to adjust the amount of anxiety or tension in the room on a moment-by-moment basis. That it's not something that you can just decide at the beginning when you first meet a patient. The point of the analogy, of course, is that really to do good psychotherapy, one adjusts this depending on how the patient is doing at any given moment. There are times in which a therapist can dig a little and challenge the patient a little bit in order to help them gain insight, and other times when it's important to be supportive and not to challenge them. This is also a bit of a critique of therapies, psychotherapies, that aim primarily or mainly to be supportive only. It's like getting on a boat and not going anywhere. And I don't really think that's helpful in most cases. Most people can get pure support from other non-professional people. They can get support from friends, from family, from coaches, religious institutions, and so forth. Psychotherapy offers something more and shouldn't be treated so cheaply, really, as something where it's simply a matter of support or encouragement. It does a disservice, both to the field and to the patients, too. You know, there's actually a technical meaning of what supportive psychotherapy really is. It's not just attaboy and you're doing great and keep a stiff upper lip and, you know, think good things about yourself. Supportive psychotherapy, technically speaking, is helping a person use the best defenses they have or the best coping mechanisms they have already developed in their life. Not to develop new ones, but to use the best ones they have. And so if a patient is able to laugh at their situation or be philosophical about it, and you can encourage that as a therapist, then you are doing supportive psychotherapy. Supportive psychotherapy, or largely supportive psychotherapy, is needed for a lot of people who are severely traumatized, who really can't get perspective on themselves and see themselves objectively, and to gain insight about themselves. Maybe they're not ready for that yet, or maybe they never will be. In such cases, supportive psychotherapy is the best thing we can offer. But to the extent that a person can understand themselves better, can gain insight about themselves, we should try to do that. There's a couple other aspects of this that extend the metaphor. One of them is that if you're on a sailboat and the wind is pretty strong wherever you're sailing, you need to take it easier when you sail. The wind is doing most of the work, and you don't really have to try to catch the wind. The wind is pushing the boat along pretty much all by itself. And likewise, if there's a lot of stress, a lot of tension, a lot of anxiety in the patient's life already, it's not necessary to impose any extra in the psychotherapy. It calls for being more supportive, for trying to maintain and enhance stability and comfort. On the other hand, if there is no wind at all, or very little, nothing much will happen unless there is a little bit of challenge or the encouragement of looking at painful or uncomfortable subjects in the therapy. So, are you sailing on a windy day or are you sailing on a calm day? That's one issue. Also, just to torture the analogy a little further, some boats are inherently more stable than others. So if you have a barge, it's not likely to tip over no matter what you do. If you have a real tippy boat, I don't know much about boats really, you have to be more careful so it doesn't capsize. So in summary, psychotherapy is a balance of support and insight, and it's a fluid back and forth. It changes in a moment-by-moment way, in a not only session-by-session, but sometimes minute-by-minute fashion, such that a sensitive psychotherapist will be paying attention at every moment. To what degree he or she needs to be supportive, can encourage insight, can help the patient come to face things that they might find uncomfortable, but meaningful and important for them to understand about themselves. If you like these videos, please subscribe, and I'll talk to you next time. Bye.